Let's discuss the points of the eye system. Stomach 1, Chengqi, container of tears. Stomach 1 is located when the eyes are looking straight forward, directly below the center of the pupil between the eyeball and the infraorbital ridge. How to find stomach 1? With the patient looking straight ahead, the first 4 points of the stomach channel are located on a vertical line drawn through the center of the pupil. Within the area of the lower eyelid, the infraorbital ridge presents itself as a distinct bony structure. Stomach 1 is located on the pupil line directly superior to the infraorbital ridge. Needling. Ask the patient to look upward. Gently push the eyeball upwards and insert the needle vertically along the orbital ridge in a dorsal direction. Caution: venous plexus and arteries. Avoid injuring the eyeball and periosteum. Needling recommended only by experienced practitioners. Pay attention to needling pain. No needle manipulation. After removing the needle, press firmly on the insertion site for about 1 minute to prevent hematoma. Inform the patient that it may still be possible for a hematoma to develop. Moxibustion is contraindicated. Points for disorders of the eyes with less risk of complications include bladder 2, TB21, GB1, stomach 2, XHN5 or Taiyang, and XHN4 Yuya. Actions or indications of stomach 1: expels wind and heat, clears and benefits the eyes. Special features: meeting point with the Yang Qiao Mai and Ren Mai, also with the Tu Mai according to some authors, important point for the eyes, entry point. Stomach 1 is good for all eye problems from heat and from exterior and interior wind. Expels wind from the face for facial paralysis, tick of eyelids. This point is used mostly for eye problems and has a very wide range of indications such as acute and chronic conjunctivitis, myopia, astigmatism, squint, color blindness, night blindness, glaucoma, atrophy of the optic nerve, cataract, keratitis, and retinitis. As it expels wind, both interior and exterior, it is used for eye problems deriving from the exterior wind heat, such as swelling, pain, and lacrimation, and paralysis of the eyelid, as well as those deriving from interior wind, such as stick of the eyelid. The stomach is the sea of liquids and cereals. It is a storehouse which receives everything we ingest, whether it is food, drink, information, or atmospheres. Stomach and spleen work together more closely than any other partnership among the officials. Together, they command the movements of lowering and raising up. The stomach likes to be cool and wet. The spleen likes to be dry and warm. As the two earth officials, they reside in the middle jiao, in the center of the body, and are the place of transformation, the place of humanity between heaven and earth. Stomach 1 is one of the two principal local points of the primary channels for the treatment of eye diseases, the other being bladder 1, and is the meeting of a network of channels. The stomach primary channel meets the bladder channel at bladder 1 before descending along the infraorbital ridge to stomach 1. The stomach divergent channel connects with the eye, and the stomach sinew channel joins with the bladder sinew channel to form a muscular net around the eye. The etiology and pathology of eye disorders is complex and varied, but may be simplified into attack by exterior pathogenic wind heat or wind cold, interior disharmony, primarily flaring of liver fire, uprising of liver yang or deficiency of liver yin and blood, or a combination of both interior disharmony and exterior pathogens. Not only is stomach 1 able to dispel pathogenic factors such as wind, cold, and heat from the eye, but by strongly invigorating and stimulating the qi and blood of the local area, it is equally applicable for disorders due to any kind of interior disharmony and is therefore indicated for the fullest range of eye diseases. This includes the traditional categories of redness, swelling and pain, lacrimation, superficial visual obstruction, dimness of vision, short-sightedness, night blindness, itching of the eyes, upward staring eyes, visual dizziness, and twitching of the eyelids. In terms of modern disease categories, stomach 1 is indicated for acute and chronic conjunctivitis, myopia, glaucoma, astigmatism, color blindness, neuritis of the optic nerve, keratitis, and blepharospasm. As the name container of tears suggests, Chengqi, or stomach 1, is especially important in the treatment of excessive lacrimation, which is classically subdivided into cold or hot types, in both cases complicated by exterior wind. The cold type may be due to deficiency and cold of the liver channel or exhaustion of the liver and kidneys, whilst the hot type may be due to liver channel wind heat or liver yin deficiency with heat. Stomach 1 is entry point, crossing point of stomach, yang chao mai, or heel vessel, and ren mai. This is the start of the meridian, which is concerned with receiving and digesting things, food, drink, information, feelings. This point can help a person move on in their life if they are stuck mentally or emotionally, particularly with overthinking, for eye disorders such as conjunctivitis, myopia, the early stages of cataracts, or glaucoma.